Are you a woman between the ages of 35 and 55? Are you starting to note changes and decrease in your estrogen that's affecting your skin? You may be experiencing changes in your skin that are affected by the hormones in our body. How does estrogen depletion affect the skin, and what can we do about it? In this video, we'll discuss some of the changes that we see in the skin as estrogen is depleted from our bodies and some of the things that we can do to offset it and to correct it. So in today's video, we're gonna go over estrogen and different hormones in the skin and how they affect the skin and different things that we can do to correct those changes. I'm also going to talk about products and supplements that we can use to kind of offset the changes that we're seeing with estrogen depletion. I'm also gonna cover a very highly controversial and a topic that comes up a lot in my clinic and on my YouTube channel and on my Instagram, and that is, do topical estrogen creams restore the changes that estrogen loss can create in the skin, or can you use topical estrogen creams for anti-aging? So we'll go over that question. I'll also be answering some of your questions that you guys have asked me, talking about hormones and skin changes and various even personal questions that you guys have asked me, and I'll go over that at the end of the video. So I hope after watching this video, you'll have a little bit better understanding of different hormones, how they can affect the skin, changes that can be made, supplements that could help during the perimenopausal and postmenopausal period, whether or not topical estrogen cream may be right for you, and some other questions that some people have that maybe you share with them as well. So hopefully this video makes sense, and hopefully it gets into the science and can break down these changes so that you have a better understanding, so that you can make better informed decisions on treatments you have, lifestyle changes you want to make, and skincare products that you can use to kind of offset the changes that we see with estrogen depletion and changes in hormones. In last week's video, we talked about GLP-1 agonists and the effects on its skin with Ozempic face and Ozempic skin. Now, similarly, in today's topic, we're going to discuss hormones and the effects on the skin. And the reason why I wanted to do this video kind of hand in hand with the GLP-1 agonists is because I recently attended a medical conference, and a lot of doctors were talking about their patients who are noticing bone changes and bone density changes, creating osteopenia, osteoporosis, and for people who are on GLP-1 agonists to maintain their bone health, they're also being supplemented with testosterone. Now, when you give a woman testosterone, it has to be perfectly aligned with other ratios of other hormones, progesterone, estrogen, testosterone. They all work hand in hand together. So many of my patients in my practice are on GLP-1 agonists. A lot of you guys ask me if I am, and the answer is no. Not that I have anything against it, but I personally don't take a GLP-1 agonist, and many of my patients do, however, and many of the patients who are being monitored and managed by endocrinologists or naturopaths or OBGYNs or women's physicians who are giving them the GLP-1 agonist, they're also supplementing with testosterone. When you give testosterone, you also have to give it in harmony and balance with your progesterone and estrogen, and so I'm seeing them as their dermatologist because of the changes that they're noticing on their skin. With testosterone, you can have increased acne, you can have increased hirsutism, which is hair growth in areas that you previously didn't have hair. For example, in the bearded area for women, mustache hair, darkening of existing hair, and a lot of other changes that are associated with testosterone use. Acne, that could be cystic acne, that could even cause scarring acne on the back, on the neck, on the face, forehead, cheeks, the bearded distribution behind the ears. So these are changes that we see with testosterone. We also see similar changes with progesterone, and with estrogen. Estrogen is usually very beneficial for the skin. So you'll also see a more youthful appearance, an increase in collagen, an increase in elastin when you're having estrogen supplementation. But there are side effects, ups and downs to all these different hormones. So I want to delineate that for you a little bit in this video. So we talked about the side effects of testosterone and progesterone. As I mentioned just previously, progesterone can also be increased acne formation and acne lesions in patients who are having the progesterone exogenously administered in conjunction with other hormones, usually estrogen. Now, estrogen, although it does have skin benefits, increasing collagen, increasing elastin, increasing the skin barrier, hydration of the skin, allowing the skin cells to hold on to water, which gives it a plump, very hydrated, beautiful, youthful looking appearance. Estrogen, when applied topically, can also have deleterious effects on the skin. And this answers the question, can topical estrogen cream be used for anti-aging effects? So topical estrogen, when applied directly onto the skin, has been investigated for its anti-aging potential. Now, it may increase collagen, and it may increase elastin, and it may restore the barrier. However, there are other anti-aging peptides and actives that do a better job at that than just plain topical estrogen alone, without some of the side effects that topical estrogen may create, and that is hyperpigmentation, hirsutism or increased hair growth, and acne, and increased sebaceous gland activity. Now, sebaceous gland activity means increased sebum production, which a lot of people as a misconception think is a good thing. It's actually a bad thing. Increased sebum production causes large pores. It causes comedonal and non-comedonal acne. Just like oils aren't great to put on the face because it stretches out the pores and it overstimulates the sebaceous gland, which gives that pewed orange or orange peel skin in dermatology. You want to downregulate those sebaceous glands and allow those skin cells to hold on to water. Water, not oil, is best for your skin cells to maintain hydration and overall optimal cellular function and health. If you look at Dr. Zaino Baji, who is one of my mentors, he was one of the first pioneers in dermatology to talk about downregulation of sebum production, downregulation of oil glands. So any hormone that's going to stimulate upregulation of that glandular activity is going to lead to acne, large pores, blackheads, and a textural regularity, that pewed orange skin that we're trying to avoid. So although there may be potential benefit to a topical estrogen cream on the skin, like collagen production and increase in firmness and elasticity of the skin, increased hydration, less dryness, we can achieve that with other active ingredients: L-ascorbic acid, vitamin C, anti-aging polypeptides, vitamin A derivatives like retinaldehyde, retinol, tretinoin. And although tretinoin may potentially cause initial irritation and dryness, it actually, once your skin gets used to it, has a much better beneficial potential overall than just topical estrogen cream alone. And this is what the data and research is showing us in a meta-analysis and looking at anecdotal as well as statistical data from randomized controlled trials and anecdotal evidence in patient offices and data that's presented at our academic meetings. So there has been a lot of questions about using topical estrogen cream on the face. I guess you could. It wouldn't be my recommended treatment of choice. Now, placing topical estrogen cream alone on the face would not be the recommended choice for anti-aging potential. Now, being on a bioidentical hormone like an estradiol or an estriol gel that will increase your circulating estrogen levels will have skin benefits, and the benefits are a more youthful appearance, increased hydration of the skin because it's going to restore that lipid barrier and the natural moisturization factors that are in your skin that help retain water in the skin cells to give a plump, very hydrated appearance, because as we lose estrogen, the opposite is true. The barrier gets compromised. Our lipids and our natural moisturization factors, which are the actives that kind of pull water into the skin, get depleted, and so the skin looks dry, it looks scaly, it gets easily irritated during the menopausal period. So estrogen also increases upregulation of collagen neogenesis. It also increases elastin fiber synthesis, and collagen and elastin fibers are the two extracellular matrix proteins that give skin that turgor. It gives it that bouncy, tight turgor, and as we gain wisdom and have birthdays, we lose those extracellular matrix proteins. And when we have estrogen levels declining, we lose more collagen and we lose more elastin, because not only do we stop producing it, but our body is breaking it down at a faster rate. So offsetting that by hormone replacement therapy or bioidenticals will have a more effective approach to anti-aging in the skin than just placing topical estrogen on the skin alone. And that has to do with binding of receptors, which is going to get way too technical and scientific for the purpose of this video. But binding estrogen topically is different than having it go through the body systemically. Now, this video is not recommending hormone replacement therapy by no means. I know that there's going to be a lot of people in the comment section saying negative things about hormone replacement therapy. I'm not an OBGYN or a women's health specialist, but as a dermatologist in the skin, I can tell you that systemic estrogen has a bigger impact on skin anti-aging effects than topical estrogen alone, with less side effects on the skin with respect to hyperpigmentation, acne, and hirsutism. Now, I may have one of the world-leading experts in women's health and menopause on my channel because the data has dramatically changed with respect respect to the Women's Health Initiative and old data that was produced and taught to me in my graduating class as medical students. When we were all graduating from medical school, the Women's Health Initiative would say things about, you know, the data was pointing to hormone replacement therapy being pro-carcinogenic, and now they're saying that it may be even protective against certain cancers. It's also protective against cardiovascular disease, Alzheimer's disease, osteoporosis, bone disease, and osteopenia. So that's a different topic for a different time and out of my scope of practice as a dermatologist, but I know that people are going to be commenting in the comment section, and I just want to be very forthcoming saying I'm not a women's health hormone specialist. I'm just a dermatologist here to present data and answer questions that come up a lot in my office, especially about topical estrogen creams and hormone replacement therapy with respect to the changes in the skin. So I would defer to my endocrine and my OBGYN and my urology and my family medicine colleagues to answer questions and take a deeper dive into hormone replacement therapy and its effect on women and the new data that we're seeing these exogenous hormones having a role in women's health and overall health. But at this recent meeting that I went to as a physician on a panel at this women's health conference, a lot of the doctors were saying that we're entering a new era where before menopause wasn't really talked about. Even when I was in medical school on my OBGYN rotation, I think it was half a lecture and half a day out of a whole 3-month OBGYN rotation out of 4 years of medical school where we talked about menopause. And the take-home message was menopause happens at age 52 and there's nothing really you can do about it. Women just have to suffer because the side effects of hormone replacement therapy are too great to offset the benefit of treatment. And women had to suffer. They went through cognitive issues, early dementia, brain fog, depression, anxiety, lack of sleep. I mean, the symptoms are countless, and it's a decade plus or minus a few years of life where women were suffering and not going through hormone replacement therapy because of data that may have been misconstrued. So I will probably link in the comments or in this bio for this video someone who you can follow for more information, but it's really important to just be well informed and educated and keep up with the latest because the data is always changing. Even reanalysis and repeat analytical statistics of data that was once presented can point in different directions. So it's really great to just keep an open mind and stay up to date with science because data and discovery is always changing. So in my office, I see women of all ages. My practice is primarily women. Menopause and perimenopause could be a 10-year period, which is a very long period of time. And it could start anywhere from 35 to 45, and it can go until 55 or beyond. It just depends on where in your life, in your age range, you're going to go through that period. And it's a long time, and there may be ups and downs. And as the menopausal period approaches, your hormones, your estrogen production by your ovaries may be high one day, low the next day. And it's that delta. It's the change in the highs and lows that can cause sleep disturbance. It can cause brain fog. It could cause cognitive dysfunction. It can cause many, many symptoms that could sometimes be improved by, certain, hormone replacement therapy or bioidentical supplementation. So as a dermatologist, I see my patients who have gone through this estrogen depletion phase in their life, and they'll come in and they'll say, "Doctor, what do I do? I'm aging overnight." I see it from anywhere from women in their mid-30s, their 40s, to in their 50s, and there's a lot of things that we can do to kind of offset those changes. Now, as I mentioned before, estrogen's main role in the skin is to increase collagen, increase elastin, which increased collagen helps smooth the skin and gives a beautiful plump texture. Increased elastin gives skin that elasticity, and a loss of elastin fibers causes that laxity. Also, estrogen, like I said, maintains the barrier and hydration status. It minimizes transepidermal water loss from the skin. So the more estrogen you have, the more hydrated and plump and filled with water your skin cells are. And then also it will help minimize irritation when you have increased estrogen levels. So by supplying increased collagen production in the skin, now you can do that by using actives like retinol. Even my RXR retinol is a very specific microencapsulated vehicle delivery system that I swear by, and I literally can't take a day off because if I stop my RXR retinol, if I run out, or if I'm traveling and I forget to pack it, I see the changes in my skin. You want to increase collagen stores and increase collagen neogenesis in the skin, and by using a vitamin A derivative, whether it's a retinol or a tretinoin or even a retinaldehyde, will have immense skin benefits while you're going through these changes during estrogen levels declining. Now, L-ascorbic acid in a vitamin C and antioxidants like L-ferulic acid, kojic acid, azelaic acid could also have a lot of skin benefits with increasing collagen upregulation. AHAs, BHAs can also help with hyperpigmentation, increasing collagen synthesis, and downregulating sebaceous gland hyperactivity, which can sometimes fluctuate, and that's why we get hormonal acne, especially along this bearded distribution, as we're going through these changes and our hormones are going up and down and causing these acne breakouts in our 40s and our 50s. So a lot of these active ingredients in your skincare routine that you're using day in and day out is really, really important to help offset those changes that we're seeing with estrogen depletion. In addition, in the office, things that we can do to upregulate collagen synthesis and upregulate collagen stores as we're having estrogen depletion and collagen depletion in our skin include lasers. So you know I'm a laser and device girl. I always have been and I always will be. Lasers induce your skin cells to act and behave younger. What does that mean? Just as we get older, our cells become senescent. Just like in your immune system, the cells become a little bit more senescent. Your neurocells, your neurons become a little bit more degenerative as time goes on. Your skin cells become sluggish and they start becoming lazy and they start reproducing and repopulating and renewing themselves, and they stop producing collagen and they stop producing elastin as they did when we were younger. So lasers are kind of like a workout to your skin. They stimulate your skin cells to act and behave younger, make more of that collagen, increases cellular renewal, restore the barrier, maintain hydration status. It's like a stimulus for your skin cells to wake up when they kind of start becoming lazy and falling asleep as we get 40, 50, and beyond. And that's why lasers are so amazing. They also can decrease your risk of skin cancer. There's a recent Harvard study a couple years back that, I guess it's not so recent anymore, that showed that Fraxel Restore laser, which is a laser I swear by, will help decrease your skin cancer and pre-cancer risk by 50%. So lasers are your best friend, especially if you're going through an estrogen depletion phase in your life. Energy-based devices like Thermage increase collagen stores. If we're losing 10% of collagen each decade, the more reserves you're building up and staying ahead of the curve, the better that you'll be later on. That's the true meaning of anti-aging. You're building up collagen stores faster or staying ahead of the curve than you're breaking it down. That's always a beneficial thing. Something else that we've been doing a lot in conjunctions with lasers or energy-based devices are biostimulatory fillers. Radiesse, Sculptra, and there are some new biostimulatory injectables that are coming down the pipeline in the United States, which is where I practice. I'm an American doctor, so right now our two biostimulatory injectables that we have are Sculptra and Radiesse. Sculptra is polylactic acid, Radiesse is calcium hydroxyapatite, and we're doing this a lot in women who are going through menopause who have kind of that like textural regularity, that laxity, especially on the inside of the arm, above the knee, in the midsection. And so these biostimulatory fillers induce your fibroblasts, which are the collagen producing cells, to make more collagen because they've been less stimulated to do so by the drop in estrogen production. Another treatment we're doing a lot of is Easy Gel. So Easy Gel is when we take your own blood products and we spin it down and we process it and cool it very slowly in such a way to we're almost making like a filler equivalent out of your own blood products. So it's like PRP or PRF, which stands for platelet-rich plasma or platelet-rich fibrin, but instead it lasts a lot longer than your traditional PRP or PRF because of the way that it's cooled and it's processed. So we're using it a lot. We started a lot with like tear trough use. Now we're using it in the nasolabial folds and the jowls. It's a great alternative to filler because we're kind of shying away from using too much filler because we were getting out of an epidemic of people who are doing way too much filler incorrectly by less than highly trained injectors, and everybody's walking around looking like a pillow face, including half the celebrities in LA and the influencers, and it's just we're getting out of that epidemic, which I still feel that it's, you know, don't hate the filler, hate the injector, because it's a lot of unlicensed providers injecting filler incorrectly. But even with that said, there are safer alternatives to fillers, and a lot of my patients in my patient population in my office will not do fillers anymore. We're doing a lot of Easy Gel. And Easy Gel, again, it has growth factors, it has stem cells, and it has proteins in your own blood products in it that's going to upregulate your cells to make collagen and make elastin and make a lot of those extracellular matrix proteins that have been declining in levels because of drops in estrogen. Okay, so we've reviewed all these different hormones, the effects in the skin, things that we can do at home with our skincare actives, and treatments in the office that we can do. Now I want to talk about also just daily healthy living and how that can have a huge impact on your skin while you're going through this estrogen depletion phase in life. So we talked about in-office procedures and what can we do at home to kind of offset the changes with estrogen depletion. Lifestyle habits as we are in perimenopause and the menopausal period in our life. It's really important, you guys, to work out and to exercise. Not to look good, but to be strong, to increase lean muscle mass, for your bone health, to decrease your risk of osteoporosis and osteopenia. You know, doing cardio and working out to look good when you're younger is one thing, but as you get older, and I'm in that camp too at 47, almost 48 years old, it's really important to increase lean muscle mass so that you're strong, so that your bones are healthy, so your osteoblastic, osteoclastic bone cells can regenerate themselves and are being stimulated to do so. Especially if you're on a GLP-1 inhibitor and you've lost a lot of weight, this is really important to increase your lean muscle mass and protect your bones and your bone health. Number 2, sleep hygiene. It might be difficult to fall asleep, to stay asleep. You may have night sweats when you're going through the menopausal period in your life, but taking supplements, magnesium for example, and I'll go through some of the other supplements to have a healthy night's sleep is really important for your overall health and your overall wellness during the menopausal or perimenopausal period. Maintaining your hydration status. Based on your height and weight, I know for me, I have to drink 2 liters of water a day because your barrier may be not optimally functional because of estrogen depletion, and your skin is having more transepidermal water loss, which is why your skin looks dry and flaky and kind of lustless. Increasing your hydration status and drinking a lot of water is really important. Now, I always say eating your water is important too. Water containing foods, celery, watermelon, different water containing foods, in addition to colorful green leafy vegetables. The more colorful you eat, the better you will be. And also, increasing your protein intake as well. And then, leading a healthy lifestyle, avoiding alcohol. Now that I'm older, now that I'm 47, I really don't drink anymore because of the glycosylation and, alcohol is a toxin. Now, I'm not saying you guys shouldn't drink. I just have, in 2025, had kind of like a alcohol-free year so far, and I feel great, and I see the changes in my body, and I'm really happy about it. So, things like alcohol, all the good fun things, that can sometimes make a more fun lifestyle, in the end can sometimes wreak havoc, especially as we're going through this estrogen depletion phase in our life. So these are lifestyle habits that you can do at home in addition to using skincare actives that I mentioned before to kind of offset some of the estrogen depletion skin symptoms that we're experiencing. In addition to coming to the office, of course, and doing in-office procedures, which would be helpful too. Okay, sometimes my brain goes 100 miles an hour, so I want to make sure that we targeted everything that we were talking about. So we talked about different hormones and their effects that they can have on their skin. We talked about GLP-1 agonists, how a lot of people who are having a dramatic weight loss and that's affecting their bone health, and a lot of providers are supplementing the GLP-1 agonists with testosterone, and when given testosterone, you always have to consider progesterone and estrogen and how all these hormones affect the skin. We talked about that. We talked about the effects that estrogen has in the skin, the positive benefits: increased collagen, increased elastin, increased barrier, increased hydration, and the loss of collagen can decrease the effects that we have in the skin, and how we reverse these, different in-office procedures, different skincare actives that we used. We talked about how the perimenopausal period and menopause can happen over a decade and can range from anywhere from early to mid 30s to mid to late 50s. That's a huge time in your life and a huge range, and that's why when I see patients at 35, 40, 45, 50, 55, and everywhere and anywhere in between, and within that age range, sometimes the hormones are high, sometimes they're low, sometimes they have acne, sometimes they have hyperpigmentation, sometimes they feel like they're aging at an accelerated rate. So each individual is different, and it's really important to be very in tune with your body, be very in tune to your skin changes. I mean, I've always been very in tune with my body. I remember, growing up, I could tell you when I was PMSing, when I was having my cycle, when I was ovulating. I got pregnant naturally with both children, knew exactly when I was ovulating, breastfed both. And so I feel that the more in tune you are with your body, and even if you have to use like an app or get your labs checked to kind of feel where you're at and just treat your skin and give yourself grace and treat your skin day day by day, month by month, year by year, because within a month it may fluctuate. Some days you may have acne, some months you may have more hyperpigmentation, some days you may feel like you're looking old, some days you may feel like you're looking better. And so just knowledge is power, and understanding why these changes are happening in our skin and why you may be experiencing different skin changes than maybe a relative or a loved one is really, really important. And knowing how to tackle it and optimal life choices that we can make to kind of offset these changes is really, really important. So now that we've reviewed all these topics and the fact that I don't really recommend topical estrogen cream as my mainstay of therapy for anti-aging effects. I think it's great for vaginal use for increasing estrogen in that area. I think it's good for increasing systemic levels of estrogen by applying a topical gel for systemic absorption purposes, but not directly slathering it all over your skin on your face, because you're going to cause acne, breakouts, beard hair growth, and a bunch of side effects that you don't want, including like telangiectasia, which is where you get these neovascularization or increased blood vessels over the skin. There's lots of side effects that we want to avoid. So if anything, take away from this video, topical estrogen cream should not be your treatment of choice for anti-aging. Now, I'm sure there's going to be people in the comment section saying, I use it, I love it, but maybe have you used other things, and have you used other active ingredients? And maybe if it works for one person, it may not work for another. So use the comment section, because this is a safe place for you guys to exchange ideas and exchange experiences that you've had with different treatments and different procedures and different things that you've tried, like estrogen cream on the face. So last, I'm going to end this video with a few of the questions that my subscribers and my patients have asked me on my Instagram when I posted that I was going to be doing this video topic. And here's a few great questions. So someone asked, is too much estrogen a bad thing? Now, of course, everything in moderation and in balance and in harmony and with checks and balances systems is really important in medicine and physiology in the body. If you are undergoing estrogen replacement or hormone replacement therapy or bioidentical therapy, it's always very important to be closely followed by a provider, whether it's an MD or a practitioner or a naturopath or whoever you feel most comfortable with their breadth of knowledge, with their credentials, and if they vibe with your kind of standards and ideals. So I think it's really important. Yes, too much estrogen can be a bad thing, and estrogen drops and changes in the delta and the highs and lows could be even worse. So, especially not to get into it, but to get into like endometrial hyperplasia, that's why you need to usually use progesterone when you're using a synthetic estrogen, and that gets really, really important. So I'm going to defer to providers who provide hormone replacement therapy, or your OBGYN or women's health physician or primary care, naturopath, and so forth. But yes, too much estrogen can have side effects, but that's why it's very, very important to have all your hormones looked at in ratios and in harmony so that you are balanced with all your hormone levels in your body. So somebody asked, hi doc, topical estrogen cream on hands, neck, skin. So we went over that earlier in the video. Could be beneficial, yes, but is it worth the side effects, and are there better things? I don't think it's worth the side effects, and there's better anti-aging topicals and actives, I think, than using topical estrogen, although the school of thought would seem promising. So hopefully that answers that question. Someone asked about the progesterone-only birth control pill. Now, hormone replacements or birth control comes in various formats. We have IUD, we have a slow depot, you have shots, pellets, injections, oral contraceptive pills. That all just is very dependent on the individual patient, on the individual woman. I have a lot of friends who did great on the IUD. My body did really well on the oral contraceptive pill. I'm still on it, low estrogen. I've been on it since I was 18, with the exception of having 2 babies and breastfeeding 2 babies. And at 47, I still have regular periods. So I'm on the low estrogen birth control pill. But a lot of my friends couldn't tolerate that. And I did go through a period right after I had my second baby where I had an IUD and my body hated it. I had melasma, I had acne, my bleeding was worse. I bled for more than 7 days. And so my body didn't do well with it. So like skin treatments, certain women do better with certain types of hormone or contraceptives than others. So that is really dependent on between you and your provider in deciding what's best for you. But progesterone only pill may be beneficial to some. So I would follow up with your provider to answer that. Someone asked about changes in skincare after hysterectomy. So just remember that after a hysterectomy, your estrogen levels are going to decrease. So you may alter your skincare regimen to address those changes. Maybe a little bit more increased collagen production. Maybe you want to have a little bit more a vitamin A derivative or L-ascorbic acid or antioxidants or anti-aging peptides. And maybe you'd want to back off on the exfoliation and the AHAs and the BHAs. So it's really important just to, see the changes in your skin and have your levels checked over time. And you probably will have to modify your skincare routine after hysterectomy because of the decline in estrogen. So someone asked me if I will do HRT when it is my time, and I will. Right now, like I said, I'm on the birth control pill, and I'm regulating my body pretty well with that. My body does really, really well with that. But, it's always important when you're checking your hormone levels, it can fluctuate throughout the day. And so looking at your hormone levels isn't as impactful as recognizing the symptoms. So, I still get my regular period, so I am on the oral contraceptive pill, like I mentioned before, the low estrin, which has probably helped with my skin as well. I mean, I just did a CO2 laser like 2 weeks ago, and that helps as well. Lasers obviously helps medical grade skincare, but I think probably being on the low estrin pill for me my entire life pretty much has really been beneficial. But when it is my time and my background ovary production of estrogen declines, I will be very open to whatever my women's health provider recommends with respect to HRT, and I'm all for it. Now that's just me, and that's my body, my choice, and I would recommend the same for any of my patients or any of you asking this question, because I think it's a very personal decision and it could be very controversial. So to each his own, but yes, I would. And last question, and this is a good one, supplements for menopause. So there are a lot of different supplements that have been shown to be beneficial during the menopause period. The black cohosh is a supplement that can help with hot flashes, night sweats, mood swings, and is very beneficial. Magnesium is just so highly recommended among all of my colleagues in different medical subspecialties. So for mood, sleep, anxiety, bone health, cognitive function. Now there's different forms of magnesium. I actually take magnesium taurate because sometimes I get palpitations. I've gotten them since I was in medical school and with both my pregnancies, and it helps with that. I do feel like it helps with sleeping overall, so many different benefits. But magnesium, and depending on the specific type of magnesium, I would maybe follow up with your provider and see which one is best for you. But I do think that magnesium has immense and very immense benefit to menopausal and perimenopausal women. So berberine helps with insulin sensitivity, with mood, with cognitive ability, and with cardiovascular protective effects. Folate, of course, we know is really important. Actually, the whole vitamin B complex is very important. I give myself vitamin B12 shots because I actually lack the gene to bind the vitamin B12 in the gut. So I actually either do the sublingual tablets of vitamin B12 or I give myself the injection, the IM injection. But vitamin B complex, all of them is really, really important, are really important for menopausal women to take. Phytoestrogens can be controversial, but can be very beneficial for women experiencing mood changes, hot flashes, and difficulty sleeping. Vitamin D3 and calcium is very, very important. I personally take a vitamin D3 K2 because I photoprotect so much and I protect my skin from the sun so much that I also need the vitamin D. Calcium is very, very important, especially with the increase of osteoporosis and osteopenia as we reach menopause. Ashwagandha, one of my favorite active supplements for perimenopausal women, also women of all ages, I think. Collagen peptides, which is always a must. I use my Vital Proteins collagen peptides day in and day out, and especially when you're doing treatments in office to upregulate collagen synthesis, like a Fraxel, or if you're using tretinoin, you want to increase your collagen peptides supplementation as well. Zinc, selenium, chromium, those are all important. A multivitamin usually will contain these. GABA helps with relaxation, healthy sleep patterns, and has a very calming effect. Nutrafol is really great for hair loss. Remember, you have to be on it a long time to notice the difference. As we start to lose hair and the hair gets brittle, it just sucks. During menopause, your skin gets dry, your hair gets brittle, you lose your hair, you're in a bad mood, you're having night sweats. So I think anything we can do supplement-wise to kind of supplement some of the nutrients that we're missing, that when we replenish them will help increase hair growth. And remember, you have to be on it 3 to 6 months to see a difference. And NMN is one of my favorites. So NMN is is a NAD precursor. It's gotten a lot of data and attention behind it lately. It has immense benefits for longevity, for overall health, decreases oxidative stress, and decreases age-related illnesses. True Niagen is the supplement that I use. Again, I'm non-sponsored, I'm not an affiliate, but that's the supplement that I use. I really like it and I swear by it. And remember, NAD by age 50 decreases by 50%. So you want to increase the supplementation of that. So you have to be careful with, the supplement source that you guys are getting your supplements from. Again, I mentioned Shervin a lot in my videos. He's a good friend of mine. He's the founder of Symbiotica, and the way they source their supplements and just the whole passion and movement behind that brand is really great. So look into, researching different supplements, but those are some of my favorites for menopausal women. Okay guys, I forgot to include an important supplement for menopausal and perimenopausal women, and that is creatine. So creatine has a lot of health benefits in perimenopausal and menopausal patients, and number one is just bone health, increasing bone density, decreasing the risk of osteoporosis and osteopenia. It's really, really important. Also for increasing lean muscle mass, which is really important, muscle preservation, because after menopause and during menopause, sarcopenia is a phenomenon that happens where your myocytes, which are the muscle cells, become atrophic or small and kind of wither away. So it's harder to keep on lean muscle mass. So this also has the benefit of increasing your lean muscle mass, which also is related to bone health. So bone health, muscle mass, and then also energy levels. It increases ATP, which increases your energy levels and increases your vitality, as well as a brain improved function for neuro improvement as well. So helps with brain fog and neuro function as well. So those are the 4 health benefits in menopausal women for creatine. And the dosing it should be in the form of creatine monohydrate. This is a brand that was recommended by a women's health physician who I follow and have the utmost respect for, Dr. Gigi Kroll. I was educated about creatine and the benefits by her. And she recommended the creatine monophosphate format, and you can buy it. This is the brand that she had posted, and 1 scoop is 5 grams, and the typical dose that's recommended is anywhere from 3 to 5 grams per day. And you can do a loading dose that's 20 grams a day, split into 4 doses. So it would be 4 scoops, maybe 2 scoops in the morning, 2 scoops in the evening, for 5 to 7 days or about a week to get your loading dose, and then you're on a maintenance dose after that. So I think this is an important supplement that I forgot to include in the video, so we can include it now, and hope you find this helpful. And I know a lot of you guys are going to ask about like IVs and hydration and glutathione and NAD and injections and things like that. Just be really, really careful, you guys, because as an aesthetic, it breaks my heart. Medicine has become very commercialized and very sensationalized, and sometimes these products, like we just went the other day, Justin had to get an IV hydration, and just went for IV hydration and detox and things like that, and they were giving him or offering him NAD injections, and the way that they were injecting it, like I even know as a physician, they were injecting it sub-Q, not IM, and when I asked a couple questions, it just, I could just tell that there was a lot of marketing and lacking a lot of science backing some of the procedures they did in the IV hydration studio, we'll say. Especially they were saying that there was an IV hydration for like skin and nails, and there was one that had a bunch of biotin in it, which was healthy for the skin. But even just recently on our boards, it was discovered that biotin is very healthy for your nails and hair, but really doesn't do much for the skin. So, just make sure that you're not getting scammed, and make sure that when you do choose to use a supplement, you look at the data and maybe have friends who have used that product and have noticed a change. Because there's nothing more impactful than anecdotal data. Like somebody starts a supplement and they notice a change. Somebody uses a skincare line and they're like, wow, my skin looks amazing. Or you can tell that they've started a great skincare product because their skin's glowing. Like the proof is in the pudding, and within today's age with all this like fake science and marketing and over-promised, outcomes that don't really deliver, I think we all need a breath of fresh air. And that's why I'm non-sponsored on YouTube. I don't take any paid partnerships, and I really just truly love you guys and want to share the education and information that I've gained throughout my career and share it for the greater good to kind of offset and protect you guys from, you know, making bad decisions or wasting money on things that not only don't work, but can actually potentially be harmful. All right, with that said, such a long video. I love you guys, and I will see you next week. Drop a comment in the comment section. Let me know what you guys are thinking and talk among each other. And there's no right or wrong here. It's just sharing of ideas and having a collaborative space where we can exchange ideas for overall optimal women's health. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.